My name is Adam Gallegos. I'm a firefighter-paramedic with the Castle Rock Fire and Rescue Department. Today we're going to be going over nebulized medication administration. First off, I want to make sure we have BSI on, gloves, and eyewear. You can also verbalize this. To start, we're going to prep the patient. We're going to assess the patient for respiratory failure versus respiratory distress. We're going to ask the patient if they have any previous allergic reactions to medications or any adverse reactions to medications. And then we're also going to explain what we're doing and why we're doing it with this procedure. Then we're going to prep our equipment. First, we're going to check our medication. We're going to check the clarity, the expiration date, ensure that it's the correct patient, ensure that, again, that it's the correct medication, that we're giving the correct dose, we're giving it via the correct route, and that we're documenting the correct time. Next, we're going to assemble the device. We have three different options. We've got a handheld device. We also have capability to hook this device up to a mask. And then we also have an inline nebulizer that you would use for an intubated patient. It's important that you follow the manufacturer's directions when assembling these devices. So first we're going to place the medication in the device. And seal tightly. Assemble the remaining pieces, and then attach the oxygen tubing to the device. Hand this to my patient. It's important to note that when you're using an inline nebulizer that you're going to need a second oxygen supply tubing to go to the bag valve mask. And now we're ready to administer the medication to our patient. First, we're going to adjust the oxygen flow to 6 to 8 liters per minute of oxygen. For the conscious patient, we want to encourage them to take big, deep breaths. We want them to keep the handheld device securely in their mouth. And if we're using a mask in conjunction with this device, we want to make sure that it fits snugly on their face. If we're using an inline neb, we want to make sure that we use the BVM to administer the medication, and we want to time each squeeze to their respiratory effort, typically around 12 to 20 breaths per minute. And we want to also ensure that the inline neb stays upright so it continues to work properly. Once the medication is in or started, we're going to document the dose and the time that we gave the medication, and then we're going to continue to monitor the patient's vital signs, any adverse reactions to the medication, and any desired effects from the medication. And this concludes the nebulized medication administration scenario.